Okay, hi everyone, good evening. Am I audible and visible?
Yes, good evening, ma'am. Yes, you are audible and visible both.
Yes, good to see you. Okay,
Same here, ma'am.
okay. Uh, so I request everyone to come up on camera so that we can have an interactive MBCT and MBSS class. So hi তিতির তিথির কা দত্ত লাইক স্পেলিংটা কি আছে মানে উচ্চারণটা কি হয় মিউটে আছো
It's Tithika.
তিথিকা আচ্ছা আর কোনো ছোট ফটো নাম আছে
Tithi?
হ্যাঁ তিথি ওইটাই ঠিক আছে অর্ধেকটা আমি ভুলে যাব তিথিটাই ঠিক আছে okay so don't confuse anyone I was talking in my mother language that is my Bengali language okay so I request everyone to come up on camera so that we can have an interactive session again I'll wait for 2 more minutes and then we can start off so yeah till Ravinder sir Rimanshu and Jeet Singh. I don't know. You people are coming on camera. I would like to have an introduction with Sheetal ma'am. I can see Sheetal ma'am first. Ma'am, your introduction. Ma'am, you are on mute. पहले भी आप ये करते हैं म्यूट खोलिए ना
Yeah, I'm Sheetal and I'm MFPC first year student. Actually, I did my master in computer science before that. And now, actually, you can say that my interest in the psychology, that's why I'm doing PG again in psychology.
yes, I remember during the INC class you asked me, can I understand anything? I said yes.
Yeah, actually, I did so many things. I did the makeup course also, nail artist course also. After that, I moved to this field, psychology field.
Then you can combine makeup and fashion psychology too. I'll help
Okay,
you.
yeah.
I'll help.
Okay, thank you.
Okay. So yes, Tithi, come up.
Okay, hello. I'm Tithika Kaur. I am a physiotherapist and a mom of a 4 years old boy. Okay, and I joined this class because in my daily hectic life, at the end of the day, sometimes I'm feeling very anxious. So for to helping in this matter, I want to join this class.
Okay, great. Okay. Yes, Alpa ma'am.
Hi, I'm Alpa Nagrecha. I am a nutritionist and working with few doctors as a nutritionist and a diabetes educator. I've done a lot of lot of things in nutrition and diet. Even psychiatry nutrition also I have done. There was a course. So I'm interested in this, like I want to link with nutrition with this thing because I somewhere feel stress is a cause of many diseases. So if we can link, and I need to learn more, I need to go in depth more for this.
Okay, yes, there are courses on nutrition and mental health. Yes. Yes, Ravinder sir.
हेलो मैम, हेलो एवरीवन। मैंने पहले भी ग्रेजुएशन कर रखी है मैथमेटिक्स से, मगर इंटरेस्ट के कारण दोबारा ग्रेजुएशन कर रहा हूँ उसमें, क्या कहते हैं, साइकोलॉजी। दैट्स ऑल।
Okay, okay. Yes, Rimanshu.
Hello, ma'am.
Hi.
Hi. See, I'm a career counselor, so I'm learning new things. I'm pursuing PG in psychology also.
Oh, great. Yes. Okay. Alpa ma'am. Yes, Ridha. Yes, Fatima. Please come up. I know you joined a little late. So could you please introduce yourself and come up on camera? Okay, I'll give you 2 minutes to you. I understand. So hi, I only believe Sheetal ma'am knows me. Apart from that, none of you know me. So, hi, I'm Sradhanjali Dasgupta. I'm from Kolkata. I am currently pursuing my PhD. This is my final year. By profession, I'm a counseling psychologist. I'm a clinical hypnotherapist. I'm a fashion and parapsychologist. I am a lactation consultant. I did so many courses on lactation. And I'm also a sex and love and king affirmative and queer affirmative therapist. But more that I'm not going to add everything because then the class would be like 12 minutes more. So I'll be doing this for the next 4 days. I believe you all would see my face, my big fat face, because I would be doing this webinar like 1 hour, 1.5 hour webinar with you all. So today the first topic is like mindfulness therapy. Now over here today, what you all understand by mindfulness? Tell me. Any idea what exactly is mindfulness? Anything?
Means if we are doing something to our mind should be there. Means 100% should be there.
Okay.
No distraction will be there. Yeah, I think so.
Yes, no distraction would be there. Anything else? Okay. Anything else? Okay. Okay. So basically, what we are going to talk is what exactly is mindfulness, what are the benefits, like psychological and physical benefits of mindfulness. We are going to understand the mindfulness from the perspective of a psychologist. I'm a psychologist and I'm going to talk about that. We are going to teach, or I'm going to talk about how to practice mindfulness, what are the activities you can ensure with your clients, what is the science behind mindfulness, and what are the exercises on mindfulness. And I'm going to give 2 to 3 or 4 worksheets you can help your client out with for mindfulness, but there are many such worksheets you can do. I myself combine mindfulness with art therapy because art communicates a lot. When any therapy fails, art is the one way to ensure what exactly is the issue of the client. So directly jumping on to what exactly is mindfulness. Mindfulness is basically nothing, it's just you are focusing on your present. You are focusing on your thought process, you are focusing on your emotions, you are focusing on your sensation, all the 5 senses it gets activated. You are focusing on your body, but you are not trying to change your surrounding. For example, if I talk about, yeah, today I am having this cup of coffee, okay, though I am a highly coffee addict, but I am not being mindful. I don't know what are the ingredients, what are there in the coffee. If I talk about mindful eating, what exactly is mindful eating? If I talk about taking a chocolate, I have chocolate in front of me itself. If I talk about having a chocolate, I would be only eating the chocolate rather than focusing, okay, after eating or completing the chocolate, what are the other stuffs I need to do? For example, if I talk about this, you all are attending the classes, but somewhere deep in your mind, you are also thinking, okay, the class is going to get over at 9 or somewhere between 9:30. After that, we are going to prepare our dinner. We are going to have our dinner. Then tomorrow we would be doing this works. That is not mindful. Mindful means, or mindfulness means, where you are in your present, completely in your present, but you are not trying to change your past, or you are not trying to focus on your future, that what would exactly happen, without being distracted. Clear what is mindfulness?
Yes, ma'am.
Okay. So, what are the benefits of mindfulness? Now, there are so many benefits of mindfulness. First, if I talk about, I'm not going to talk about what are the things written in the PPT. You all are going to get the PPT. I'm going to talk about something which is not there in the PPT, definitely. Now, mindfulness allows you to focus on your present. That means you are having, or you are letting the things go. For example, if I practice mindfulness right now, I am completely in this PPT. Or for the next 1.5 hours, I'll be completely in this class. I'm not going to think that tomorrow or after getting over with this class at 9:30, I would be doing this work. Till 3 a.m. I'm going to work. I'm not going to think though. So what I'm doing, I'm letting things go away. Basically, it's an art. Mindfulness is nothing. No one is going to teach anyone. I did not receive any such formal training on mindfulness. Please be aware that abhi there are so many things on mindfulness. Definitely. But some mindfulness is something which is very personal. I can practice mindfulness without a music. There are some people who requires music along with mindfulness. There are some people who requires crystals with mindfulness. Mindfulness is a customized thing. How you are doing it's your own way. Next is mindfulness also helps you to give a pause to your life from the so-called chaotic situation. Now we all face a struggle. We all face struggle. But the moment we are trying to focus or the moment we are trying to be mindful, we are letting all the things go definitely, but we are giving a pause button to all sort of negative stuffs which are coming in our mind. Now you can ask me, Shraddhanjali, then what is meditation? Meditation is something which requires a huge amount of training. But for mindfulness, you don't need any sort of such training. Number one. For yoga or meditation, you need your all body movement to move. Like your hand, though I won't be able to move my left finger, like left hand. But if I talk about meditation, you need to move your hand, you need to move your head, you need to move your legs, all the body parts. But if I talk about mindfulness, you don't need to move any such, like you don't need to move any such of your body organs. Then if I talk about mindfulness also makes you to be like mindfulness talks or teach you how to practice gratitude, how to be empathetic towards other, how to have a sort of kindness nature. Now how? There is a word which we use, mindfulness based gratitude. Now we are not at all gratitude to neither nor us nor anyone else. Mindfulness teaches you how to be gratitude to your own self along with others. People are there to criticize us, but we are not only going to pinpoint that, yeah, this person did something bad to me, but we are going to think what are the good things he did to me. It talks about how to regenerate your empathetic nature. Now, anyone can tell me what is the love hormone in our body, like not in the body, in the brain? What is the neurotransmitter which works on love hormone?
Dopamine.
No. Anyone? Oxytocin. Oxytocin is the love hormone. Mindfulness activates the love hormone, the oxytocin one. There are so many international, or if I talk about Western culture, there are so many people or there are so many therapists who teaches how to release, or I would say release, how to activate your love hormone or the oxytocin. I'm not talking that each and every day we are going to have a relationship. The release of oxytocin means today I am literally grateful to you all. Or today I'm literally grateful to my mom. Or it can be that no one else, only to myself. It's only to myself I'm grateful for. Because I did so many stuffs where I failed. Definitely I failed in some of the projects or some of the session. But still I tried to do my 100%. Mindfulness also talks about being grateful in this way. There are worksheets where you can ask your clients, definitely. But I'm going to talk about this. Then mindfulness helps you to reduce pain. Now there are so many psychosomatic therapists. Now what is psychosomatic? Mind and body connection. Hota hai, if you have noticed that we are not, I'll tell our own case of mine, our OPD case of mine. I had a client. She had visited more than 20 plus gynecologists, 10 plus cardiologists, 5 plus physiotherapists, and so many consultants. Endless number of consultants. I remember the very first day when I saw her, it was a huge bunch of prescription. Then at last, when he visited an ophthalmologist, I don't know why he visited, but he visited, the ophthalmologist said, you don't have any sort of body issue. You have mind issue which is being manifested in your body. And you need to talk to a therapist. And he was like, I am not pagal. Why should I visit? Then the ophthalmologist explained in his way that you are not pagal. I understand you are not crazy. You are not moron. I remember because the ophthalmologist is one of my friend only. And she said, you are not a moron itself. But it's your life, how you are not doing good things. Now, what does good things means? He had some issues of guilt. Now, guilt was being manifested by elbow pain. He has repressed emotion. Now, guilt feeling, which was being manifested by the elbow pain. Being a psychosomatic therapist, I worked on his issue. And it took, mark my words, it took only 12 sessions for him to overcome his guilt. And his pain was like, and he said me, I remember he said me, Shraddhanjali, are you a magician? I said, yes, I know magic. But it's nothing magic. I just explored. I kept on exploring more on psychosomatic. I'm not talking about psychosomatic therapy, but I also taught him MBC, that is mindfulness-based cognitive therapy. And he did wonder. So mindfulness also help you to reduce your body pain. It's not only the emotional pain, it's your body pain also. You can understand where the pains are. I can tell you the example of my father. My father, every time he used to tell me that some sort of uneasiness is being walking. I said, what exactly is uneasiness? Which organ? He was like, no, mere ko pata nahi hai. But I'm feeling uneasy. I started exploring more and more. Definitely I used constellation, which is much more experiential. I also taught him mindfulness. Then he said me, yeah, I was having issues in my chest. For 5 long years, he did not realize that he was having chest issue. Like chest issue, matlab he was feeling pain. But he said, he kept on saying, all the consultants, especially our house doctors, that I'm having some sort of uneasiness. Now this term uneasiness was not being clear. So it also helps in that. Next is mindfulness helps you to be more focused and concentrated. We are not focused at all. Definitely, even me also. After this class, I know after having my dinner, I'm going to chat with my boyfriend, then I'm going to fight with him. Though everything would happen online, but yeah, I know that. But if I'm mindful, I'll be thinking over, why should I fight with my boyfriend? Basically, MBCT, that is mindfulness-based cognitive therapy, I would be doing on myself. I'm going to talk what is that. So it helps us to be more focused. Now, as I said, we all are thinking after the class, I'm going to prepare my dinner, then I'm going to have my dinner, then I'm going to wash and I'm going to get fresh. It's not like that. The moment you are mindful, you are only going to think about the present. Present matlab where you are now, the present situation. You are going to get aware of your thoughts. You are going to get aware of your emotions. You are going to get aware of your body. Each and every body parts. It's not only one single body, it's at each and every body part. Starting from here, ending till the fingers print. Then also definitely mindfulness helps to cure. I won't say cure, but helps to deal anxiety in a very practical way. We all are anxious. Anyone knows what are the types of anxiety, stress or anxiety? How many sort of stress and anxieties are there? Positive and negative stress, that is the de-stress and eustress. We all have all this sort of stress. None can tell, or I don't know what are the therapists do claim, but even me being a therapist, I have anxiety, I have stress. But I know the exact way to handle that. Stress would be there. Without stress, I know I can't function properly. Without anxiety, I can't function properly. Not in my personal life, not in my professional life. But if I am mindful, I would know why such sort of feelings are coming up. I would know how to manifest it. Next is it regulates emotion. Now, if you have heard of the term borderline personality disorder, it's a sort of personality disorder. Cluster B. There are 10 personality disorder. Borderline personality disorder is a cluster B sort of disorder where people don't know there are so many clients who slist off their wrist because of emotions. They don't know how to handle their emotion. And it's completely visible. The moment they are in that session, we can see the hand. Oh, so many cuts. So we teach them mindfulness. Definitely thoughts are going to come. Definitely so many negative emotions are going to hit our brain. But it's not that we are not going to keep the negative thought and we are only going to take positive things. No. Mindfulness teaches you to take the negative thoughts also, to work on that. None in this whole maybe none of us are picture perfect. We have so many pros and cons. But the only thing is that we know how to work on that. Mindfulness talks about not to criticize others as well as yourself. हम लोग बोलते हैं ना, it I can't do. हम लोग कभी, like if I talk about myself, though I am doing my PhD, though I have cleared my net, I still, people, if anyone asks me, Shradhanjali, could you please talk about research and stat? I'm like, no, please. See, the moment I said, my heartbeat started. I would get goosebumps. Like, research paper, no, mere se nahi hoga. So it's a thought of negative emotion which is hitting my brain. That no, Shradhanjali, you can't. Because I did not give a try only. But if I knew, or if I give a try, I know I can. Somewhere below the line, at least 20% to hoga mere se. But still, I did not give a try. Mindfulness teaches you to take the positive as well as the negative and work on the negative. Clear till now?
Yes, yes.
Okay. Next is, now I definitely I'm going to talk about magic. Now, if you are doing mindfulness in your own way, you can create magic in your own life. I'll tell one thing. The moment I travel in metro, I am highly, it's not that I have issues with claustrophobia or something. I tend to get nervous that mere bagal mein kaun baitha hoga. Whether it's a boy, whether it's a girl, but whether it's a transgender, I don't have any problem. But I get a feeling that kaun mere bagal mein baitha hoga, because I am very sensitive to body smells. Now today itself, when I had a guy who was sitting beside me and he was smelling very foul. I was like, why did he came up? Why, in which station he is going to go? So I was thinking on my own mind. So suddenly, I know mindfulness. I did stone practice mindfulness. And believe me, it took only 3 to 4 seconds. Even nanosecond also I can say. That my all thought of thoughts which were coming that, ye kahan pe utrega? It went out. There are so many clients who says me, Shradhanjali, how to handle traffic anxiety. Traffic में तो कोई therapy नहीं होगा. I definitely do stone practice with them. Pebble practice or stone wala practice. I'm going to talk what is that. So you can create a magic, because if I was having that sense of notion that when he is going to get out and when I'm going to breathe a complete good sort of oxygen, I was making my head in such a manner that I was creating a mess out of myself. But I did mindfulness-based, not mindfulness-based, a sort of pebble therapy, which is a sort of mindfulness only. No one knew that I was holding a very big bag and I was scanning my thighs. It was only my thigh, because I can't scan my whole body over there in the metro. So I took my thigh, because I was doing like this. I don't know, you can't see, I was doing the leg like this. So I was having issues over my thigh. And I started scanning my thigh, but no one noticed. So you can create magic if you know how exactly to do that. Then definitely self-awareness. If I was not being self-aware that kahan pe mera problem hai, I wouldn't have ended up doing my thigh rather than I did my shoulder or my elbows or even my head. But I could figure it out that I was having my issues in my thigh and nose. Definitely I scanned my nose and also my thigh, because he was coming in my thigh and I was feeling very awkward. And I knew that he was drunk. So that's the reason I was feeling very awkward. It was not because he was smelling bad also, because he was drunk. Because I was having that awareness. How did I develop? It was not in a minute that I developed. It was a long practice which made me develop mindfulness. Mindfulness is such a stuff which can make you do wonder in your life, only if you know how to practice that. It's nothing a sort of magic. I don't have any magic wand in my hand. It's just that you need to be aware how to do that. Where exactly to do that. What sort of right activities you need to do that. That is what the benefits of mindfulness. Clear the benefits of mindfulness. Am I
Yes.
clear with the benefits? Okay.
Yes.
Okay. Next is definitely I'm going to do this activity so that you all can understand. Mindfulness helps you to be aware of your body. Now, if I talk about body shaming, there are so many people who body shames us. Even I was being body shamed, I was being bullied because of my body when I was in my school days. But even now also I am being bullied because of my body, because I am having a lower, like my from my like stomach, my entire lower portion is very bulk. People body shames me. But at the end of the day, every single day, it's not only one day I do it, every single day when I come back from my practice and everything, I make sure that I am completely naked and I hug my body. Because we have a tendency to hug everyone. Are ma, baba, papita, like anyone, any sort of relationship, we tend to hug them. But we don't hug ourselves. That is one of the biggest failure where we lack. Because we are not loving ourselves. We have branded shoes, we have branded dress, we have lipsticks, everything. But the moment I can tell you my very own experience here, even wearing Ritu Kumar's dress, I was like, मेरे में सूट नहीं हुआ. But I was looking good. My mom said, my dad said, even my partner said me, Shradhanjali, today you are looking good. But somewhere I was feeling, no, I'm not looking good. I kept on changing the dress. Konsa, I was looking good. And whatever dress I kept on wearing, I was like, no, I'm not looking that good. Because I did not like my body. The day I started liking my body, even a small pimple also, believe me, now, and if anyone says, Shradhanjali, you are looking low, I'm saying, yeah, I'm looking low because I look good if I'm looking low. It's not that we have to shine every single day. We can't. At least we can't, because we belong from such a family culture, or from that mediocre family where spending thousands on thousands every single month, it's not possible for us. But the moment we start nurturing our own body, the moment we start talking to our own body, now talking matla, we have to talk to our own self. It's something we need to do, but we don't talk. How many of you know empty chair technique with your own self, apart from Sheetal ma'am? Anyone who knows empty chair technique with your own self?
No.
Okay. Okay. Just Alpa ma'am, just remind me at the end of the session, I'm going to show how to do empty chair technique with your own self.
Okay.
Clear all the benefits, everyone?
Clear.
Okay. So here, why to practice mindfulness is being given over here. What are the things I explained? It's given over here. So I'm not reading the PPT. Now I'm going to talk about the exercises which you can do. Now please make sure that this is not only limited. I gave 15. Yes. 15 exercises. You can even cure it on your own self if you know any sort of therapies. Now, number one is grounding with gratitude. Now, grounding with gratitude means we know gratitude. Okay. Now, what does grounding with gratitude means? We have to sit in the ground with a piece of paper. Any color paper would go. We have to sit so that our hips are touching the ground. And we have to write gratitude letter to ourselves, to the universe, and to everyone. Now, how to write to ourselves? Gratitude. Number one is, today I am looking beautiful. Today, taking your name, for example, if I write, Shradhanjali, you did a wonderful job because of so and so reasons. Shradhanjali, you are looking good. So we have to write our own name. It's gratitude to our own self. Now, gratitude to the universe, how it means? We have to thank God. It's a sort of spirituality, definitely, but we have to thank God that today I survived. We are doing and we have survived to this day. Thank you, God, for giving me a wonderful day. Definitely, when I did my inner child healing, I'm not going to talk about inner child healing right now. My mentor said, or my supervisor said me that Shradhanjali, gratitude has to be practiced every single day in two times, in the morning and in the night. So, but we don't have that much of time to practice in the morning. So in the night I practice. And it's not that every day I practice, honestly, every alternative days. Every alternative days I do practice gratitude. Every single Sunday I practice cord cutting, and every single day, matlab every single day I talk to my own self. And whenever I'm inside, like no one is there, I make sure that I am naked and I'm standing in front of the mirror and I'm hugging myself. The moment you all start doing, you would definitely, it would take time. It was not within a second I did a notice to everything. It would take time, at least 21 days. Because if anyone knows NLP talks about 21 days. Your brain needs to do anything, whether good or whether bad, any sort of activity, any sort of new lesson, 21 days are required. And hence 21 days. Okay. And gratitude to others means thank you for criticizing me and helping me grow more. Thank you for criticizing means the moment, see, it's that whatever good also we are doing, people are going to criticize. Whatever bad also we are doing, people are going to criticize. So why to take a note of that yeah, he had criticized me. So the moment we are thanking them is the way we are improving our own self. Mindfulness talks about how we can improve. It's not that I am teaching anyone. Like for example, I can teach everyone, but the thing is that how well you are doing that. आप कैसे adapt कर रहे हो? If you are not adapting, it's a loss on your part. If you are adapting, then it's a cherry on the top. Grounding techniques with gratitude clear in 3 different ways. Okay. Next is hand mapping. Now, what exactly is hand mapping? You have to take a hand, though I'm taking my left hand itself. Now you have to close your eyes. Anywhere you can do, whether you are traveling, whether you are sitting, whether you're in your bathroom, you can do. Now I'll talk about a constipation case. Okay. So you have to slide your finger, one finger, and you have to stress your body. Keep on pressing. How is it going up? Then down, then up, then down. And yes, you have to concentrate on your breathing patterns. How you are breathing. It can be your full hand. Hand mapping also, when I'm going to do sensate focus therapy, you all can understand how hand mapping you can use with your couples. Couples matam boyfriend and girlfriends as well as husbands and wife. Now it can be your palm also with the other palms. You are revolving your other hand. Can you feel the texture of your hand? Whether it's rough or whether it's very smooth? That is what. It can be in this way also. Anyway, whatever way you feel like. This is called, and it has to be with both the hands. Left, right, with both the hands. Clear about hand mapping? It can be forehead mapping with 2 fingers the moment you are mapping your forehead. You can notice if there are any such pain in your forehead or not. You can even notice that. You can do hand mapping with the karate chop. This is what, if I talk about EFT, this is the karate chop. You can do it like this. You can glide over here itself. You can feel whether this portion is very hard or very soft. You can even tap over here. This is what hand mapping includes. Next is 5-4-3-2-1 technique. Now this is most popular technique which every therapist uses. 5 things which you can see around yourself. 4 things which you can touch. 3 things which you can feel. 2 things which you can smell, and 1 thing which you can taste. 5-4-3-2-1 technique basically means where you are activating all your 5 senses. Clear about 5-4-3-2-1? Okay. Next is this one I was talking about what I did today in the metro, stone of stability. Now I'm not having a stone over here. What exactly I do? I would take a very big stone, depending on my bag. And I have it every day. Like whenever I'm traveling, I have that stone in my bag. So I would take a stone. Okay, let me take this one itself. So this is not a stone. So I assume this to be a stone. And the moment I am in a state of anxiety or I'm in a state of stress, I'm going to take out the stone and I'm going to push it like this. Stone beach mein hoga in your palms with all your five fingers covered, and you are going to feel the stone with your fingers. Or it can be done in this way: you are taking the stone in one of your hand and you are mapping the stone, but definitely you are being mindful, you are focusing on your breathing pattern. You can hear your breathing, like you can hear the sound how you are breathing also. We generally do not notice such things. The moment we try to notice, that the moment we feel that yes, right now we are achieving a sort of mindfulness. Sixth one is cloud watching. What exactly is cloud watching? When you are traveling, you can watch the cloud. You can make certain sort of constellations. Even cloud watching can happen in the form of visualization. You can close your eyes and you can start creating a cloud with your hand like this. It's not necessary you have to go out. When you are in the bus or any sort, or definitely when you are in your storeroom or bathroom, you can't go out and see the cloud and come back to your washroom. Definitely not. That the time you can use both the hands and create cloud and be mindful, so that you are also focusing on your feet, like breathing posture. Clear? What are the six sort?
Did we
Now
do the
the fifth
mirror
one,
grounding?
ma'am, mirror grounding.
Okay, so sorry. Yeah, I missed it. So what is mirror grounding? If you are not having a mirror, also it can work, but definitely अभी मिलता है ना छोटा वाला mirror, like the very decorative one. So take a mirror and start hugging. Now hugging definitely means you are hugging like this. Mirror grounding is a thing which you can do in bathroom or definitely in your private space, but not anywhere outside so that people can see. But yes, if you are not doing mirror grounding, you can also go for grounding self, which is called as grounding self, where you are hugging yourself, but the only thing is that your finger should be like this. It should be apart. It's not like that you are hugging. Your fingers should be like this.
And mirror, this is called mirror grounding.
Yes, where you are
Okay.
having the mirror, and in front of your mirror, you can be
Okay.
naked, you can't be naked, anywhere up to you, and you have to hug yourself.
Okay.
Mirror
Okay.
grounding and mapping can also go. For example, when you are in front of a mirror, if you are naked, definitely you can start mapping your whole body like this. Again, this comes also in sensate focus therapy, where we teach the
Okay.
couples to love their own body as well as to love their partner's body. Mirror grounding and hand mapping also happens with the couples, where there is a sexless marriage. Like for last 6 months I was having a very like intimate marriage with my partner, but abhi for last 3 months or 3 weeks my partner is not loving me. That the time I combine sensate focus therapy, mirror grounding, hand mapping and feather technique in a four manner. Definitely I'm going to talk in the sensate focus therapy class, where basically you are hugging your partner and you are moving your hands, both the hands, in the partner's body, any partner's body. But if you are practicing mindfulness, it has to be in your own body.
Okay.
Clear all these six? Okay.
Yeah. Clear.
Okay. Okay.
Yes.
Next is memory scent. Now, memory scent is something which is where you are taking a sort of perfume. You are inhaling the perfume, but definitely you are not chirking anywhere. You are taking the smell and you are trying to recall, or you are trying to recollect all the memories, good memories, which are associated. हम लोग बोलते which are associated with any situation. Like it's a sort of perfume therapy, where we tell na, Arey, I have scented, I can feel, I have seen, or I have smelled this perfume before. I don't know exactly where. Olfactory things comes in. So that the time memory scent. So that if I talk about any sort of memory, I associate with a fragrance. It's a sort of fragrance therapy or perfume therapy, whatever you all can say. Basically, to recollect all sort of good memories. You can also use this technique with your clients. Now, how? There are clients who would say, I am missing my partner in a long distance relationship. Being a family therapist, what I do is I also go for memory scent technique. I ask the partner to buy some sort of, like, for example, if I'm missing my partner is not there in India. But I know what the perfume my partner would be liking. So I would be buying that perfume. I would be applying in my whole body, and then I can feel, or I would be going by the process of visualization. And I would miss my partner, but not to that extent which I was missing. Memory set can also go with family couple sessions also, where you can ask your partner, like, to decline to buy the perfume and apply, and then try to recollect all sort of good things which have happened with your partner. Definitely then moving the fingers around the body. Okay. Next is tactile exploration. Now, what is tactile? Now, over here, we basically collect some sort of shapes. Now, if I talk, I have so many things in front of me. This, this, I have pen, I have handkerchiefs, I have everything. I have my cup, laptop. Basically, what are the things which I can see? Now, I would be taking one on one everything, and I would be exploring whether this is very rough, whether this is very smooth. Definitely, under me it's not a very smooth thing, bahar me it's a very smooth thing, and I would be doing in such a manner so that my hand get accustomed that yeah, this is very smooth, whereas the pen is not that smooth. And then after completing what are the stuffs I would be having, I would be trying to create a sort of comparison. This is good, this is not that good, but yes, this is pretty handy to carry. This tactile exploration happens within 1:1. Like 1:1 matlab you with your own self. It's a very time consuming process because it happens with minimum 3 to 4 items, and a maximum time of 45 minutes are being required for tactile exploration, where you are exploring the size, the shape, the sort of texture the item is having, each and everything in a very barik manner, in a very detailed form. Next is cold water. Now, this is a sort of hydrotherapy. What does cold water means? In a bowl, you are taking chilled water and you are pouring your face, only your face. Whenever we are stressed out, and if you ever in your after this class, if you are getting stressed, definitely taking in consideration of your health, you can try this whenever you are stressed. I do it whenever I'm stressed, even if it is 2 degree in my area. But what I do is I would be taking a bowl. In that bowl also cold water. It can be baraf ka water. It can be water which is having ice. Any sort of chilled water, and I would be pouring my face. What would it happen? Your all sort of skin pores would be getting activated definitely, and you would be getting a relief. Now, if you can pour it for more than 5 minutes, it's better. But generally, it can't be, because if anyone is having asthma, it's very difficult for them. If anyone is claustrophobic, again, it's very difficult. If anyone is having hydrophobia, it's very difficult because they can't keep for more than 2 seconds. So, no matter what the duration is, put your face, come out. Put your face, come out, and if possible try to bubble inside the water. ऐसा होता है ना जब babies लोग नहाते हैं, they start doing and some sort of musics are being created. So cold water and bubbling goes well. You can see bubbles inside that. It's a sort of mindfulness. Next is sound of silence. Is very clear. What exactly is sound of silence? You are not using any sort of gadgets. You are sitting and you are hearing the sounds which is being available. For example, if you are sitting quietly for 5 minutes, you can hear the ticking of your clock. You can hear others outside in your house, they are talking. You can hear the horns, like the horn in the transport. You can basically hear each and everything. That is what sounds of silence, which means you are observing the silence. It can be nothing, no sort of sounds are there. You are just in your state of mindful and you are just sitting like this. You are not doing anything. No mobile, no Facebook, no Instagram, no LinkedIn, nothing, nothing, no WhatsApp, nothing. You are just observing the silence, nature around you. No music. Okay. Next is sand tray. Now, sand therapy, if anyone knows what is sand therapy, you all can relate. So, basically, in a tray, you collect sands. Now, sand therapy is something very expensive. In inner child, we use sand therapy, but you can get sand anywhere outside, also in the nature. Collect some sand, collect in a bowl. If I have a small raft over here, collect some sand in the bowl and then try to trace it. Though I am not having the sand, it is to be in this manner. And the bowl can be big also. It's not a bowl, it can be tray, it can be anything, but it can contain at least this much of sand so that you can move your fingers or move your palm so that you can explore the nature of the sand, whether the sand, what color of the sand is, how you are feeling, basically a sort of exploration with the sand. And also you can combine sand tray with storytelling. If you have miniatures, you can use miniature and you can create some sort of stories. Sand therapy, like not sand therapy, I'm not going to utter therapy now. Sand tray, you can also use sand tray in corporate sessions. If you know EAP, you can use in the corporate sessions so that people can be aware. Now, when I conduct corporate session, I use sand therapy a lot because they love it. Pebble top. Now, what exactly is pebble top? Pebble top is another sort of activity. You can use pebble, you can use coin. Definitely, I'll be giving a video of mine, what I do in pebble top or what is the process. Let me take a page. Okay. So, if it is a page, you are collecting pebbles or you are collecting stones. Sheetal ma'am knows this. And then with the pen, with the help of the pen, you are moving the pebble out of the page. The moment some sort of structures are being created with the pen, you are now jotting down with 3 dotted line and you are drawing something. This is a technique in art therapy, like not art therapy, expressive art therapy also. I'll be giving this video of my own. Definitely you can't see the face because of some confidential issue with the client, because we are not supposed to circulate the faces, but I would be giving the video. Sheetal ma'am एक बार group पे लिख दीजिए ना. I know people, Sheetal ma'am knows I tend to forget, but don't worry, I'll be sharing the video. Next is mandala with music. Now, mandala, if I talk about mandala, you all can think that mandala is very tough. Mandala is not that tough what you all are thinking. Now, mandala can be, you are drawing, for example, mandala is just a circle. Let me show you. For example, I'll be doing a mandala. Now, I'll be drawing a circle. Okay? And in this circle, I can do anything. Now, for example, I'll be drawing a horizontal line, then vertical line, again horizontal line. Now I have created a picture. Is it visible? I don't know. Visible? Is the page visible?
No, ma'am, not.
No, it is not.
Not visible. Okay, I'll click the picture and I'll send. হ্যাঁ
এখন দেখা যাচ্ছে
দেখা যাচ্ছে ঠিক আছে ঠিক আছে So I have created something. Now inside the boxes I would be drawing some sort of flowers. It can be flowers, it can be dotted lines, or it can be fish, anything, basically anything. Just the thing is that mandala means, please don't confuse the one which you will see in Google or everywhere, that has been created by artists. We are not artists, we are not here to make anyone artist. But mandala, definitely background music would be there. Now background music doesn't mean some sort of musics are coming. It can be you are playing a music and then you are doing something, or it can be you are not doing something, you are just going on creating this sort of feeling. Just a second, I'll wait. Yeah, this sort of structure, you are just going round and round and round. This is what mandala with music. Now, with music means you are playing some sort of music. Again, what sort of music? It has to be instrumental, or has to be some sort of Buddhist music, and nothing. No zigzag, no Shakira, no Sunidhi Chauhan, nothing. Next is body hugging with music. Now, this is one which you can do in bathroom. What I said, you can play a music. Definitely, I play my own music in from my tab, and then you are hugging your body, each and every body parts, scanning and hugging. Now, for example, if I show, it's like this. Now, definitely, you have to close your eyes. You would be scanning. Okay, after scanning for 5 minutes, 7 minutes, whatever the time ratio would be, you are hugging yourself. Music would be there. Any sort of soft music. Instrumental music are being preferred, but a small music also can be. But no certain sort of zigzag or dash or some sort of rocking, popping, nothing. Then is mindfulness eating. Now, what exactly is mindfulness eating? Mindfulness eating means where you are eating anything, but you are being mindful. For example, it can be dal chawal. Now you observe how you are feeling. The moment you are giving one nibbala in your mouth, how you are feeling. Mindfulness and gratitude also goes well. That today I am thankful for this food. To whom? To the gratitude, like to the universe and to me who I have made the food. Mindfulness eating means where you are eating mindfully and also you are keeping in mind of the ingredient. Clear mindfulness eating? Okay.
Yes.
Now, why mindfulness? Now, there has been some sort of, I won't say theories, but there has some sort of science. Number one, very most famous is it helps in the reduction of stress. Now, any idea what is the stress hormone or what are the stress hormone?
Cortisol.
Cortisol, okay, and what is the cortisol is the primary one. Where is cortisol? In which gland?
Adrenal.
Adrenal. Okay, and another one most important.
Thyroid gland. No.
No, no. It's in the hypothalamus.
Hypothalamus.
It's also a result for blood pressure, increased blood pressure.
Oh.
Vasopressin. These are the two hormones which generally gets activated when you are in this level of stress. But it has been proved, and there are so many researches done, which shows that you can decrease the level of cortisol and vasopressin due to due to mindfulness, any sort of mindfulness. Number one. Next is if I talk about mental health, definitely anyone working with PTSD, post traumatic stress disorder, mindfulness definitely helps. Without mindfulness, you can't help a client coming with PTSD. It's PTSD issues. PCOD issues can also be cleared, depression, anxiety, stress, everything. But if I talk about telomere, any idea what is telomere? TELOMERE. Okay. Do you know that due to high stress, high anxiety issue, you can age more faster than at your age? For example, if you are 21, if you are having high age, like high stress level, you can look like or you can feel from inside that you are turning to 32, though you are 20. Telomere is a sort of protein which results for increase of which protects us from aging. Now, if you are aging too fast, definitely you can ask a dermatologist. When I had worked with dermatologists, this is the thing which I knew it from a dermatologist, that due to telomere, high rate of telomere, our aging happens lots and lots of at a higher pace because of stress. And mindfulness can help telomere also to be in that level. Like हम लोग बोलते हैं ना that you are not looking. For example, if I tell that Deepika, she is not looking as if she is 42. Why so? Because of her telomery which is being like controlled. Okay. Now brain structure. Now any idea what sort of brain structure would be responsible for stress and anxiety? Anyone? No one? Okay. Anyone heard about gray matter in your brain?
Gray
I'm not
matter.
kidding. Gray matter, yes. Gray matter in amygdala. Okay.
Not very sure.
Okay, not an issue, doctor. So what exactly happens when you are having stress issue, anxiety issue, depression issue, your gray matter increases. That helps that helps for fear. For example, fight and flight mode. If you are fearful, then the gray matter in your amygdala increases. Mindfulness reduces the gray matter, and which helps to reduce your fear also. For those who are having fear of anything, fear of cockroach, fear of exam, for them, gray matter in amygdala increases a lot. And at the time, mindfulness works wonder. So basically, gray matter reduces due to mindfulness. Okay. Now, any idea about attention? Which sort of brain structure is responsible for attention, like having a higher attention span? 1, 2, 3. 3 hoga. Like when I said about being focused, mindfulness helps you to be focused. How? Like how matlab why? Brain, any idea what are the sort of brain region which are associated with attention, focus or concentration? Okay, number one is the prefrontal cortex. I did not mention it over. Oh, it's mentioned. Okay. Number one is the prefrontal cortex. Number two is the limbic system. I hope you all remember the brain and the nervous system. Okay, I'll share a picture of brain and everything. So basically it's the first one is the prefrontal cortex, which is associated with attention, focus, concentration. Then is the limbic system, which is associated with the same, and then is the anterior cingulate cortex, which is associated. Now all these things, like all these three regions, are being mainly responsible for us to be focused. Now if you are not focused, that means any sort of disturbances are there in the brain region. But mindfulness, again, it's a proven sort of research which has been done. If you are mindful, then all the three sort of brain region are being controlled, which helps the client or which helps an individual to be focused. Clear about brain, like brain structures and mindfulness?
Yes.
Okay. Okay. Now, there are many times the moment, even it happened with me, I'm not going to lie, the moment we are trying to be mindful, some sort of hindrance comes. There is a blockage. The very first thing is impatient. We are not at all patient. अभी के बाद क्या होगा क्या होगा क्या होगा उसके बाद ये definitely I'm not talking about a structured routine, but I'm talking about being mindful. We all have routines that इसके बाद I'm going to do this. But we need to be patient. We need to be calm, composed to complete one single task. But no, I won't name any individual. But the moment today before the class, I remember Roma was telling me that suddenly she was asking, I'm not naming who, would I be getting the certificates? Would I be getting the PPT? Would I be getting the worksheets? That is a result of impatience. Class shuru bhi nahi hua, and we are thinking about the sort of things we are going to receive. That is what which hinders our mindfulness. And it's very important to be impatient. If you are impatient, you can't concentrate even if your structure or even if your memory is too good, because you are not being able to concentrate. It's a sort of attention issues. Next is distraction. For example, I'll tell my own example. The moment I would be sitting now, not now, but in my initial class, in my initial time, I was like, okay, I am mindful. After 2 or 5 minutes, mark my word, at least not even 10 also, I was thinking, okay, did my friend like my picture which I have uploaded in my Facebook? Okay, so how many followers did I get in my Instagram? Oh yeah, mindfulness ka. I got up, okay, I'm having my phone. Then, okay, I'm being mindful. Again, a sort of call, a group call. That means I was being in conference. Now chit chat shuru ho gaya. PNPC start ho gaya. That is what distraction means. And also distraction can be like, from tomorrow I would be doing. Aaj chhod do, but from tomorrow. Tomorrow is like, okay, on Wednesday we are going to do. Okay, Wednesday ke baad Thursday we are going to do. Definitely on Thursday we are going to do. Thursday nahi aayega. Friday aa jayega, Saturday aa jayega, nahi aayega Thursday. Because of distraction. Because of a hormone. Any idea what sort of hormone is this? Which is pretty much activated? Dopamine rush. Because of the dopamine, we are almost like, abhi karna hoga. Tomorrow, tomorrow, tomorrow. We keep on postponing tomorrow. Aaj nahi, tomorrow. And if we are controlling this sort of issues, definitely by the method of mindfulness-based cognitive therapy, then we can handle mindfulness. Now, what is mindfulness-based cognitive therapy? So, I am not going by this. Now, I am only going to talk about the main differences between mindfulness-based therapy and mindfulness-based stress reduction. So, what is cognitive therapy? We all know, where we are addressing issues of our cognition, our thinking process. I'm not talking about cognitive therapy right now, but I have to talk. Now, what exactly is cognitive therapy? Where we tend to have irrational thought patterns. If I talk about, I am having a feeling that in tomorrow's class or in tomorrow's exam, I would be failing. And if I fail, that means I am going to commit suicide. And if I commit suicide, so and so thing happens. If so and so thing happens, that would happen. Lamba list ho gaya. It's a sort of irrational thought or irrational fear. Kuch bhi. CBT would help. But for this sort of issue, mindfulness-based cognitive therapy works wonder. What is mindfulness-based therapy? We are only focused on breaking the negative thoughts of the client. ये negative thought है ना, that tomorrow I'm going to fail. I did not appear for the exam only. How can I know that I'm going to fail or not? But I know tomorrow I'm going to fail. Or I know I won't be able to sustain in my relationship. I know my mom doesn't like me. I know this. अरे मेरे को सब पता है. मेरे को सब कुछ पता है. Even though I did not go for that. So in mindfulness-based cognitive therapy, we focus on breaking that. Definitely there are techniques how to break that. ऐसा नहीं होगा, okay, चलो काची लेते हैं, हम लोग काट देते हैं. Thought break हो गया. We have to address why so. But in mindfulness-based stress reduction, we only focus on reducing the stress, where we are not addressing any sort of negative thoughts, where we are only focused on reducing the stress level. And the thing is that the target audience are also different in mindfulness-based cognitive therapy and stress reduction therapy. In mindfulness-based cognitive therapy, we focuses on depression, we focus on stress, anxiety, any other issues which can start from psychotic as well as neurotic. But in stress reduction, we only focus on the neurotic issues, a lighter sort of issues. That is stress, any sort of health issue. I am very impatient. That is not a psychotic issue. That is a neurotic issue. There is a difference between psychotic and neurotic. So that is a sort of neurotic. In SR, stress reduction, we addresses any sort of neurotic issue. But in CT, we talk about both psychotic and neurotic. And also, the duration matters. In in MBCT, so mindfulness-based cognitive therapy, the duration can be somewhere from 1 month to 3 months or 2 months. But stress reduction, it's 8 to 10 weeks maximum. And what is the approach? Now the approach for CT is different, SR is different. For CT, the approach is only CBT. If you know SFBT, you can also use SFBT, the power of sarcastic questioning. But mostly you can use the power of cognitive behavior therapy or cognitive therapy, removing behavior therapy. But when I talk about SR, that is stress reduction, we use yoga, we use meditation, we use stress management. If required, we can also recommend the client to have a proper diet, recommend to a dietitian, recommend for overall checkup with the gynecologist, as well as your physical issues. This is the only difference between cognitive therapy and stress therapy in mindfulness. Clear?
Yes.
Okay. Now, what is the traditional CBT and what is MCBT? Traditional CBT include only, like it would be if you are doing only CBT. Yes, Sheetal ma'am.
Yes, Sradhanjali, ma'am, actually, I'm confused about these two words. You said that neurotic and psychotic. No? So how we will recognize this? This person is comes under in neurotic and this one is psychotic.
Okay. Okay. Alpa ma'am, you wanted to say something? Okay. So neurotic are basically the lighter version. Anxiety, stress, depression. And psychotic, it would include schizophrenia, borderline personality disorder, paranoid personality disorder, some sort of phobia, some sort of fear, like higher level of fear. Now, there are so many psychometric tests also. I'm not going to talk about psychometric tests. If you are dealing with psychotic issue, you can go with Rorschach, you can go with 16PF, TAT, anything. But if you are dealing with only neurotic issue, no certain psychometric tests are needed. Art therapy and certain sort of psychological interventions you can do. I'll click a picture and I'll share the difference between psychotic and neurotic.
Okay, thank you.
Okay. Okay. Next is what exactly is traditional CBT? In traditional CBT, we only use cognitive therapy and behavior therapy. CBT, cognitive behavior therapy, combines two therapy, cognitive therapy and behavior therapy. But in mindfulness-based therapy, we use mindfulness and cognitive therapy. That is mindfulness, cognitive and behavior therapy in a combination. And for both the techniques or both the approaches differs. Now in traditional CBT, or what exactly is CBT, we use the power of cognitive restructuring for some sort of defense mechanism. If I talk about altruism, if I talk about blocking, repression, suppression, there are so many defense mechanisms: neurotic defense, mature defense, immature defense. So we use cognitive restructuring. But for MBCT, we can use what are the exercises I said you all over here. We can use that. We can use meditation. We can use any sort of grounding technique. We can also focus on now and now. Now and now, matlab it's a sentence. Now I would be here. Dot. Now I won't be here. For example, I am saying now am in the class, full stop, but again, now I am not in the class. It's a now and now situation. The moment now and now situation comes up, we tend to think what is now appropriate for us. That means I'm getting vanished. That means I'm completely disabled. So I would be thinking in my mind, what exactly is the orientation of, not orientation, what exactly is the originality of me, whether I am here or whether I am not here. This is what now and now in MBCT means. Clear? Now and now I understand it's very, I won't say difficult, but it's a very time consuming process for everyone to resonate, because you have to ask the client in that form itself, in sarcastic wala or humor wala questioning portion. But it's easy. It's not that it's very difficult, it's easy. Okay. Next is how you are going to ensure whether the client can practice or not practice mindfulness. How to incorporate gratitude. Now, every single day, we have to ask the client. Again, it's a again, it's a sort of CBT and also MBCT, that we have to ask the client for the next, whenever, for example, today I have taken a session, and what exactly is the day today? 17th. So again, I'm going to take the client on 29th. Okay, so there is a huge long gap. So starting from 18th to 28th, we have to ask the client to write what are the things we are being gratitude to, we are being thankful to. It's like I am being thankful to my mom. Why? What did your mom do? For giving me food. I'm thankful to my partner. For what? For kissing me. I'm being thankful to my partner for again what? Again what? For giving me this dress. Again, I'm being thankful to my haters for hating me and making me so powerful. Now, powerful doesn't mean that I can fight. It's a mental power. How you are training your brain. If you use now incorporate gratitude, can also happen in Gottman therapy. Anyone knows what is Gottman therapy? Gratitude? Family therapy, basically. Okay. In Gottman therapy, Gottman talked about how you can express your love in 5 different languages. We all know the sort of 5 languages. But for example, if I say, after marriage, I did not thank my husband. So definitely, if definitely censored focus, I'm going to talk. But abhi I'm giving a that like quick thing. My husband went for a shower. Okay. Now I'll be taking some sort of papers, sticky notes. I would be writing, thank you for kissing me. Like before bathroom, before he went for taking a shower, what are the things it happened? Good memories. And I'm going to stick it in the mirror, so that the moment he's out from the bathroom, he would be going in front of the mirror and he can read it and he can feel, yeah, some sort of sparks are there. This is Gottman. Basically, there are so many Gottman therapy. This is one portion to be grateful for. Next is increase awareness. How you can increase awareness? You can ask the client to make number 8. Go on making number 8. Now, the moment you are making number 8, why number 8? Because you have to be very mindful when you are doing like this. It can be in power of visualization, how I am doing, or it can be in a form of pen and paper. You are asking the client to make number 8. To increase awareness, basically to increase the level of focus. Next is monitor the mood. Mood tracking is over here. Yes, mood tracking is over here. This is the worksheet which we give it. Now, not only this, there are many worksheets which we give it to the client to track the mood. 8 to 9, how was my mood? Definitely our mood changes. It's not that today I am very happy from 8 a.m. to 8 p.m. No. There are some situations which makes us very angry. There are some situations which makes us feel that अरे ये भी हो सकता है, sort of surprising. If you know wheels of emotion, you can understand there are so many sort of emotions. From there, we have to track the mood. How to track the mood? It's on the client. How to know what exactly happened. So that now this handy tips means it's only for MBCT, cognitive therapy, not stress reduction. Now in stress reduction, what it happens? We ask the client to set a daily intention. Daily routine. Basically starting from Monday to Friday, a sort of daily routine. Why I said Friday? Because Monday to Friday are weekdays. Different routine. Saturday and Sunday are different routine. Because weekend starts. We have to ask the client to set up daily routines. Now after setting the routine, we have to make the client aware. Now it's again a form of CBT. How exactly to achieve the routine. For example, if I write from 8 to 9:30, I'm going to read a book. Or I'm going to read a journal, whatsoever. The moment my phone rings up, I'm like, अभी तो नहीं होगा. हाँ हाँ, tell me. I know that. अरे आधा घंटा तो अभी नहीं होगा, कभी नहीं होगा, हो गया. So we have to ask the client to be very aware that no matters whatever important calls are, whatever routine you are making, you have to stick to that routine. And after you are getting stick, now monitor your mood means two things it happens. After you are getting stick to that particular routine, how you are feeling. And if you are not getting stick to that routine, how you are feeling. You have to ask the client to write it down. Both how you are feeling, if you are sticking, if you are not sticking. So that as a therapist, you can understand where exact the client is lagging down. Now, before they setting a daily intention or daily routine, you have to ask the client to take a break. Now, I wrote music break. It can be any break. It can be mindful eating break also. Now, this last wala thing, like take a music break, breathe on focus, engage in hard work, it's a sort of mindfulness. Music break means where you are asking the client to make utilized of the music. What exactly is the music? To pinpoint all the lyrics. We don't often hear the lyrics. गाना अच्छा लगा तो हो गया. For example, अभी the song which is trending वाला, वक्त बर्बाद ना करो, the one which is being done by a South Indian actress. I forgot the name, but we did not focus on none of us did focus on the lyrics, but those who did had a very good mindfulness utilization. We need to focus on the lyrics. And why music? If you are setting any sort of music, you can understand the power of your concentration, how long you can focus, whether you are rewinding and you are listening to the music. There are so many like people who says that, ma'am, I can't understand what the client is, sorry, what the music wants to say. That is not because that is in the mother language only or the regional language. Why can't I understand? Because we did not focus itself. We need to focus. We only keep on focusing, which is a very trending wala. पुष्पा झुकेगा नहीं, ले हलवा हो गया. पुष्पा झुकेगा नहीं, किसको बोला पुष्पा को झुकने के लिए? That is because I remember one of my clients said me, Shradhanjali di, I made a reel today. I said, what is the reel? Show me. She was like, पुष्पा झुकेगा नहीं. I said, wow, great. How did you make? I made it because people were making. So I said him that make a reel out of this song. And he was like, song hi samajh mein nahi aayega. I said, this is a Tamil song and you are from Tamil background. You have to make it. So you have to ask the client to be very mindful. Whether it's a music, whether it's a book, whatever the client is doing, to be very mindful about. And then focus on your breathing pattern. What is the sound? Because if you keep quiet and at least focus on your like nose or your breathing pattern for 2 minutes also, you can hear some sort of sound which the lungs produces. But we don't tend. No one knew that our lungs can produce sound. But when I had worked with certain gynecologists, they explained me how can a lungs makes noise. Because we have to be focused. If you are not focusing, we can't understand what exactly is the sound of the lungs are. Next is engage in handwork to have the sensory motors activated. We are always like typing wala posture. Handwork can also be typing, but pen and paper works more so that the gripping can come up. Especially this last wala thing, engage in handwork is only for children coming from 15, like teens, because they are highly addicted to mobile. मोबाइल से एक भी मिनट दूर नहीं रह सकता है वो लोग. So we have to ask that whatever you are doing, whatever tasks I am giving, instead of typing it down, I am giving you the worksheets. You have to do it with pen and paper. Here comes the role of worksheets, to use the power. Power matlab with pen and paper, so that the moment you are doing with pen and paper, you are not doing like this. You have to touch with your fingers, not your fingers, with your hand you are touching the paper. You are also feeling that. Before writing, you can ask the client to feel the texture of the pen, like of not only the pen, of the paper. Whether the paper is crunched one, whether it's so soft, whether it's the gratitude wala which is available, because in Amazon today itself I was seeing there are so many paper which are not very soft, like smooth, but they have some sort of dust particles, and you can rub and see. So that sensory things gets activated. It works wonder with autistic babies. Anyone who had worked with autism can relate because they have issues with fine motor and gross motor. With to activate fine motor skill, we use this also. And don't worry, I'm going to share this four pictures of the worksheets. This last wala, the specs wala thing is only for the babies. This, though it's been broken, but in the original picture, it's not been broken. I can assure that. Okay, কোথায় গেল? This is a thing. This, yeah, the sensory collection. This is a thing you have to ask the client to do as a sort of homework, and we generally give this client to this worksheets to the client. Number one is that 5-4-3-2-1 technique, warmth or cool, whatever you prefer, depending on your mood. And this sensory collection has to be done on every single day. For example, on Monday I preferred cool thing, Tuesday also, but Wednesday I was literally pissed off with my mother, and hence I preferred some sort of warmth. I was burning in fire. From here you can establish a rapport with the client, because there are so many clients who feels that our therapist only talks with us. क्यों बोले हम? क्यों बोले? Why should I say my secret story to my therapist? I don't know her. I don't know him. This is the way we can also establish rapport. Next is I am gratitude too. Now it has been given person. Person का नाम लिखना होगा. Then I am grateful for giving me a pen. For example, giving me a pen. I am grateful for pen, for giving me a pen, because without the pen I was not being able to complete my homework. Exam पे होता है ना, that the moment our pen refills get over and we don't have extra pen, we tend to lend a pen from our from our friend. मेरे को एक pen दे दो ना. So that is a sort of thing I'm grateful for. Next is a mindful week. Now this is a sort of worksheet you can give to your client. It goes well with couples also, where each and every day you have to ask the client to write this. Something I hear for on Monday. What are the things client heard on Monday? It can be negative things also, it can be a positive things also. Generally, why negative? So that we can help the client to understand that always in our life people are not going to please us. People are not going to love us. People are there to criticize us. Out of that criticism, you have to make something in your life. We have to make the power sound. This is a sort of CBT technique also. Cognitive restructuring. People would blame you. That doesn't mean that you are a bad therapist. People can say you don't know what is rational REBT. It can be I don't know. It's not possible for a therapist to know each and every therapist. It's not possible, but that doesn't make me a bad therapist. I know CBT, I know DBT, I know SFBT, I know psychodynamic, I know narrative therapy, I know storytelling, I know PTP, but I don't know REBT. So what's the big deal? So again, a sort of CBT techniques are given over in the mindful week. And the last one, where specs, nose, hand, ears, and lips are written, is the 5-4-3-2-1 technique. 5 things which you can see, 4 things which you can smell, 3 things which you can touch, 2 things which you can hear, 1 thing which you can taste, like with your tongue. Basically, our activation of all the 5 senses. This you can use, this last worksheet you can use till the age of 22. After that, we don't use any worksheet of 5-4-3-2-1. We give a sheet of paper, we ask the client to do 5-4-3-2-1 technique. But till age of 22, we use this worksheet. Clear?
Are we getting this sheet?
Yes. You are getting
Okay.
it.
Okay.
Okay. Any doubt till now?
Can you just repeat this 5-4-3-2? मतलब पहले जब आपने initial slides you had explained, I did not get it.
Okay. 5-4-3-2-1 technique is basically a sort of grounding technique to be more aware, to make the client in the present. Okay. Now, if I say, what are the 5 things you can see? Client would be telling, I can see the ring light, I can see my laptop, I can see my pen, I can see my cup, 1, 2, 3, 4. I can see my handkerchief. 5 things. 4 means whatever you can smell. 4 things, it can be the room, like the scent of the room. It can be the scent of your, like the smell of your hair. It can be the smell of the coffee. It can be the smell of your own body. 4 things which you can touch. Definitely, if I say that I am seeing the fan, for example, in 5 technique wala thing, I can't touch the fan because it's too high. So 4 things around me which is being touchable. It can be my chair, it can be my ring light, it can be my pen, it can be my tab, and it can be my coffee cup. 2 things which I can hear. Definitely the voice of my therapist. And if I being more calm and composed and mindful, I can hear the sound of the watch ticking. Tick, tick, tick. And last is one thing which I can test. That is my coffee. This 5-4-3-2-1 technique is just for the client, to make the client be aware. Those who are very restless. Clear?
Yes, yes, clear.
Okay. Okay. Any doubt till now?
Yes, ma'am.
Yes, yes.
Please discuss the grounding with the gratitude portion.
Okay. Grounding with the gratitude portions happens in 3 different ways. Number 1 is gratitude to myself. Now, gratitude to myself means, okay, is it okay if I explain her in Bengali, everyone? Okay.
I don't understand Bengali.
Okay. No, did you understand, ma'am? Okay, I'll explain in English only. Number 1 is gratitude to myself. Gratitude to myself means, don't worry, Titika, আমি তোমাকে আলাদা করে voice পাঠিয়ে দেবো.
No, ma'am, I
Gratitude.
understand. I understand.
Okay.
I don't have any issue with it. Okay, please
Okay.
continue.
So gratitude to myself means where I am being gratitude to my own self. That means, for example, I got up at 5. In my routine, I had set up that, okay, in my mobile 5 ka alarm diya hua tha. I got up at 5. So I am grateful for that. Because every single day, even after the alarm rings, I'm like snoring. But today I managed to get up at 5. So I am being gratitude to myself for that. Second, it can be today I'm being gratitude to myself for wearing a sari on my own. Third can be today I'm gratitude that, yeah, at 9 or 8, I could take up the classes. Basically, thanking note to my own self today, whatever I did, even if it is a bad. Okay. Second is gratitude to the universe. Okay. Now, for what exact issue of the universe? We don't know that today, the moment we are going to sleep, kal hum log sunshine dekhenge ya nahi, we don't know whether we are going to die or not. But we survived. Sunday night we slept, and Monday morning sunrise we have seen. So we are being gratitude to the universe, that thank you universe, or thank you God for helping me survive, or thank you God for making my life beautiful. Because you can eat dal chawal, but there are so many individuals who don't have a food at least for once a day also. If I talk about this street food, we can eat golgappa, we can eat biryani, but if I talk about the poverty wala babies or poverty wala individual, they won't be eating. Whatever we are throwing it off, they are eating that. So we are being grateful for the universe, we are grateful to the God. Third is grateful to others. Grateful to others happens in 2 different ways. Over here, we are going to thank the one who have appreciated us. That thank you, so and so, for helping me out. But we are also going to thank to our haters, to our critics, to criticize us. I'll share my very own story. Pehle, I was very sensitive to criticism. The moment people used to criticize me, I used to start crying. It was my initial day when I started practicing, 15, 16. The moment my mentor, Dr. Paramita Mitra Bhomik, explained to me that, Sradhanjali, if you are crying, that means you are getting weak in this posture. Please don't do that. Criticism is a part of your life. Dheere dheere, I started working on mindfulness. I started on 2018. Now, today, even if people criticize me that, Sradhanjali, you did not do a good, or you did not explain well, definitely I would taking it as a positive thing. Because people did not like the way I taught, or people did not like the color synchronization. For example, this color. It can be anyone who can criticize this color. That suddenly blue and blue is something very different. I am not getting. So you are not good at making PPT. I would definitely appreciate the fact that the individual have criticized me, but again, I would again appreciate the fact that today, whatever I have done, it's on my own. I took no one's help. This is what thanking to others and thanking to the critics means.
Yes, ma'am. Thank you. I understand.
Okay.
আমারও কিছু ইস্যু আছে আর কি এই ক্রিটিসিজম নিয়ে আইদার আই ক্রাই অর আই ফাইট উইথ দেম
It's better to fight and ask. See, criticism, life is a life में बहुत सारे आदमी लोग आएगा who would be criticizing you, but the main thing is that how we are gelling with the fact. People can criticize no matter, even if you are doing good thing in your life also people would criticize you. I would share a story. The day when I became the state president of West Bengal Mental Wellness Council, I was at the age of 28, 2 years back. Still, I am the state president. People, there are so many therapists who started criticizing me. There are so many friends of mine who started that, Adi Shradhanjali, how did you become the state president? Because president itself is a good, like huge board in my shoulder, a huge responsibility. Now it's the state where I have to ask the West Bengal person to work with me. Every single month I have to conduct workshops. Every single month I have to sit for meeting with CM Mamta Banerjee. Every single month. So it's not a very easy task for me. Because though I did party politics when I was in my college, I was the district secretary, but that too when I was in my college. It was in a small forum. But when I became the state president, it became a huge responsibility. Then when in other organization, when I became the district president, I was like, Are mere ko kyun? People would criticize you. But the moment you start working on more and more on your criticism level, people again would be criticizing, Are she's doing wonder. And definitely you are going to do wonder. It's just the way how you are training your brain and nothing else. Because believe me, this particular year, I did 15th batches. Sheetal ma'am was on the last batch. I did 15 batches on practitioner on inner child healing. People started criticizing me. Arya, how did Shradhanjali manage so many batches? Arya, I had the capability to do that. Why don't people understand that? But again, if someone is criticizing me from my own batch, I would be modifying that. For example, it can be anything. It can be, I don't know a single question. It's not possible for most of us to know all the answers. But definitely what we can do. We are not going to say anything wrong or we are not going to manipulate that individual. Basically, we can ask that individual that after so and so number of hours, I'm going to come back. Because it's just a sort of exchange of knowledge. It's not only I am saying something. It's just that whatever others were also saying me, that Shradhanjali, can it be like that? Would it be like that? So it's an exchange of knowledge. Criticism is a very huge part in our life. But the moment we know how to handle that with gratitude, definitely we can make a magic. Now, how I did, I stay in Kolkata, you know that. I am from Barakpur. Whenever people search psychologist in Barakpur, my name is on the top. And I don't have any such SEO team for me. I don't have that much marketing team. Whoever are there, like Akanksha is there for recording, Ashish is there for other purpose. There are 5 members in my team. But I don't ask them to circulate my name, give this. But it has been the grateful for everyone who came to me, who have benefited from my side, whatever therapy I did it. Now, one of my very close friend, she got jealous of me and she, from 5 ratings, she created 2 fake Google profile. And I knew who was that. What did she do? She went to my Google profile, she gave 1 star and she came back. And then from 5, it was being 4.9. And the name was being very similar. So we see, if I could fight back, then why did you do so? So what was the use? She won't have changed her mentality. Neither I would be fighting with her. So what I did, I let it go. Let her go. If you are happy with that, you can do that. But what I am happy with, I would be doing that. It's as simple as that. So right now we have anger issue. But the thing is that how well we are managing. Whenever I am angry, I tend to listen to Bhojpuri song. Though I don't understand any lyric, I tend to listen to Bhojpuri song. And luckily, thank to my best friend for that. See, you can see Swiggy notification is coming. Because whenever I'm sad, I'll search on Swiggy if I can get a pizza or not. Because I am highly addicted on pizza. But I don't go on Facebook and I'll do like a poem wala thing. You criticized me. No, never. People would criticize. But the thing is that the moment you try to ignore them, they are going to get more bad. Like, why she's not reacting? It's not always that we have to react. Kabhi kabha reaction, giving a bad reaction is good. But the moment you try to give more and more responses to that sort of negative people, they are going to, ami to ragiye dite parlam. That sort of mentality comes up. And luckily, my best friend, he is a boy. He explained to me in a very good format. The Shradhanjali kono din rege jabi na. And I don't get angry right now. I know how to make people angry. People criticizing me, I would smile, taking all my teeth out. And they are going to, why she is not getting angry? Even whether junior, whether senior, no matter. I would be doing like that. It's a sort of CBT technique. Okay. Okay. Any doubt?
No.
No, it's clear.
Okay. Thank you so much. Okay, I hope you all enjoyed. Okay, just the thing is that I would request everyone to write down your name for certificates. I would ask Tanya to do that thing so that you all can get the certificate. So there would be 5 certificates in total. One for all the things, like for this class, next class, and one in a huge wall of part. Like that would be a certificate of achievement. So for that, I request everyone to share their names. And after
So you would put only the names, or the photo is also required?
No, only the name, ma'am. Only the
Okay,
names.
fine. Okay. We put it in the group, right?
Yes. Like 1, 2, 3, 4, kalke you can put it.
Okay.
Okay. And after every classes, Akanksha would be uploading. It would take time, at least 2 hours to upload the recordings. Don't worry, before tomorrow's class, at least by tomorrow, 10 a.m., the recording would be getting generated and it would be uploaded. I would give the link in the description where all the study materials and the recording would be uploaded in the different format. Like there would be 2 folders. In one folder, the recordings would be there, and the other folder, the PPTs and worksheets would be there. So that it would be handy for you all. At least you won't have to search in the group. Okay. So tomorrow I would be doing off with, I believe, grief therapy, if I'm not wrong. Okay. So no matter, tomorrow grief therapy would be there. And last day, why I kept sunset focus, because it's on a huger portion. So sunset focus would be on the last day, so that you all don't get tired up on sex. Yes, people do get tense to get, Shradhanjali, abhi sex ke baare mein mat bolo. I'm like, okay, fine. Okay, so after like post my dinner, I would be sharing 2 links. YouTube link, so you can watch how exactly not mindfulness, body scanning happens. And I'll be sharing the Pebble wala video. Okay?
Okay.
So tomorrow I'll see you all with grief and trauma therapy. So just give me half an hour to 1 hour. I'll upload every single thing.
Yeah. Sorry to interrupt. You had asked that end में आप empty chair technique बताएंगे.
हाँ जी. What exactly is empty chair is, you have to take 2 chairs. Okay, I'll share a picture. Okay, before sharing, I'm explaining. You have to take 2 chairs. I'm removing this background so that you all can see. Okay. So you have to take 2 chairs, not side by side, face to face. And in one chair you would be sitting, and in the other chair you are going to make. Now empty chair happens in 2 ways: when you are doing with your own self, or you want to do it with others. So in one chair, your own picture, or you are going to sit, and in the other chair, you are going to keep the picture of your own. Now you are going to ask, or now you are going to talk, whatever trauma, whatever hidden emotions are there, or it was there when you were in your childhood phase, in your adolescence phase, in your teenagers phase, and you are going to communicate with that picture. Now the second thing is same technique. You would be sitting over here, and if you want to vent your emotion out, for example, it can be your mother-in-law, it can be anyone. Why I said mother-in-law? Because of some stereotype that sasuma is not good. But generally it can be anyone. So if you are not having the picture of that individual, you can write, you can take a white green color page. Now green is for healing, and hence green color page is required. So you have to take a green color page, you have to write the name of the person in bold, okay, and you have to keep it in the chair. Now whatever things you want to communicate to this person, you have to exactly ask that individual. That you also use foul language. No matter, you have to use very sophisticated, very high profile languages. You can use foul language, you can give gali. It's a sort of venting out, where what you are doing, you are venting out your repressed emotion, you are all sort of negativity. Now this requires time. If you are doing every single day, it's good. If you can't do every single day, you can do it alternative days: Monday, Wednesday, Friday, Sunday. I do every Sunday. I don't have that much of time to do it every single day, or alternative days also. At least minimum 10 minutes are being required for empty chair. I'll share a picture, but not a picture, but a video. But in that video, whatever would be given, you can also use that with your own healing purpose. Like you are healing your own self. It's a sort of inner child healing. I'll share the picture in the group. Clear? Alpa ma'am, I don't know Alpa ma'am.
Yes,
Alpa
yes,
ma'am.
very much clear. Thank you.
Okay. So I'll share this video also, don't worry. Okay. So I hope you all understood what is mindfulness-based cognitive therapy and stress therapy. So post lunch, I'm going to give the PPT. A PPT I'm giving it right now, but I would be uploading in the drive after post my lunch. So yes, Akanksha, you can close the recording, not an issue. So tomorrow I'm going to see you all same timing. I know